What if I told you that you could reduce or even eliminate knee and leg pain in just 10 minutes a day without a single pill, injection, or surgery? Sounds too good to be true? Well, stay with me, because in this video, I'm going to show you 5 simple but powerful exercises that help relieve knee and leg pain naturally, even if you're over 60, have arthritis, or haven't exercised in years. These are the same low-impact, joint-friendly moves that physical therapists recommend, and I'll show you how to do each one safely, step by step. And here's the best part. You won't need expensive equipment, you won't need a gym, and you won't need painkillers. Just a chair, a wall, and 10 minutes a day. So if you're tired of stiff knees, aching legs, or pain when walking, climbing stairs, or getting out of bed, this is the video for you. Let's get started. Section 1. Why knee and leg pain happens. Before we jump into the exercises, let's understand what's actually causing your pain. Most people think it's just aging, but that's only part of the story. The real root causes are weak muscles that don't support the joints, tight tendons and fascia, pulling your knee out of alignment, poor posture and body mechanics over decades, inflammation from food, lifestyle, and stress. Over time, these factors cause wear and tear on the knee joint, tightness in the hamstrings, weakness in the quads and glutes, and stiffness in the calves and hips. But the good news is this: gentle movement can reverse much of the damage. Even if you have arthritis, past injuries, or long-term pain, moving the right way will reduce inflammation, restore strength, and improve blood flow to help heal tissues naturally. Section 2. Exercise safety for seniors. Before we begin, a few quick safety tips. Start slow. If you haven't exercised in a while, begin with 3 to 5 repetitions. Breathe normally. Don't hold your breath during any movement. Stop if there's sharp pain. Soreness is normal, sharp pain is not. Use support. A wall or sturdy chair can help with balance. Consult your doctor if you've had surgery, joint replacements, or cardiovascular conditions. Now let's move into the first exercise. Section 3. 5 exercises to fix knee and leg pain checkmark. Exercise 1. Seated leg raises strengthens quadriceps. Why it helps: the quadriceps, the muscles in the front of your thigh, stabilize the knee. Strengthening them takes pressure off the joint. How to do it: sit tall in a chair. Extend your right leg slowly until it's straight. Hold for 5 seconds, then lower. Repeat 10 times on each leg. Pro tip: add a rolled towel under the knee for comfort if needed. Exercise 2. Wall calf stretch. Releases tightness in lower leg. Why it helps: tight calves can pull on the knee joint and affect walking posture, increasing knee pain. How to do it: stand facing a wall, step your right foot back, keep heel on the floor, lean into the wall and feel a stretch in the back leg. Hold 20 to 30 seconds, switch sides, repeat twice per leg. Pro tip: breathe deeply and don't bounce. Exercise 3. Glute bridges, strengthens hips and hamstrings. Why it helps: strong glutes and hamstrings reduce strain on knees by stabilizing the pelvis and legs. How to do it: lie on your back, knees bent, feet flat, squeeze your glutes and lift your hips up, hold for 5 seconds, then slowly lower. Repeat 10 times. Pro tip: place hands by your sides for balance and support. Exercise 4. Standing knee bends, improves flexibility and blood flow. Why it helps: gentle knee bends increase circulation and range of motion, perfect for stiff knees. How to do it: stand behind a chair, bend one knee up toward your glutes, hold for 5 seconds. Lower slowly and repeat 10 times each leg. Pro tip: don't force the bend. Go only as far as comfortable. Exercise 5. Heel slides, restores knee range of motion. Why it helps: this exercise improves flexion of the knee joint, especially helpful after surgery or long-term stiffness. How to do it: lie on your back, legs straight, slowly slide one heel toward your buttocks. Hold briefly, then slide back down. Repeat 10 times each leg. Pro tip: do this on a smooth surface or bed with socks on. Section 4. Bonus tips for long-term relief. Want even better results? Combine the exercises with these supportive habits. 1. Hot and cold therapy. Heat loosens joints before exercise. Ice reduces inflammation afterward. 2. Use anti-inflammatory foods. Eat more turmeric, berries, green leafy vegetables, and omega-3 rich foods. Avoid sugar, fried foods, white bread, and processed snacks. 3. Stay hydrated. Joints are 70% water. Dehydration causes stiffness and cramps. 4. Don't sit too long. Get up every 30 to 60 minutes and walk around for a minute. Section 5. Common foods that damage knee and joint health. Some foods silently harm your muscles and joints every single day. Here's what to reduce or avoid. Processed meats increase inflammation, contain preservatives. White flour triggers blood sugar spikes that worsen inflammation. Sugary drinks promote joint swelling and stiffness. Vegetable oils like soybean or corn oil. Highly inflammatory. Eat this instead: olive oil, nuts, berries, salmon, green tea. Section 6. One-day joint-friendly meal plan. Breakfast: scrambled eggs with spinach plus 1 slice. Whole grain toast, 1 cup, green tea. Lunch: grilled salmon with quinoa and steamed broccoli. Snack: half-baked sweet potato plus 10 almonds. Dinner: chicken soup with turmeric, carrots, and celery. Before bed: warm almond milk with a pinch of cinnamon. Final thoughts. So there you have it. 5 simple exercises, easy to do at home, that can help you reduce knee and leg pain without medications. If you do these daily, even for just 10 minutes, you'll start to feel more strength, less pain, better balance, improved mobility. Let us know in the comments which exercise felt the best for you. Subscribe to Forever Active for more trusted senior health advice every week. Tap the bell icon so you don't miss our next video, which will cover natural remedies for joint inflammation. Remember, stay strong, stay active, and stay forever young.